Now with our GMA cover story, and we've been talking about this, Princess Catherine revealing her cancer diagnosis, telling the public that she is undergoing preventative chemotherapy. So joining us now with more on the diagnosis and the treatment is ABC News medical correspondent Dr. Darien Sutton. Dr. Darien, always great to have you here. Obviously, Princess Catherine saying in the video message that she sent out to everyone that this came after the abdominal surgery, and then they discovered this cancer. How common is that?
Well, you know, it's not. When you talk about this, it depends on, number one, what the type of cancer is. We won't know, given that we're respecting her privacy, and we don't need to know. But it's important to understand that when you're diagnosing a cancer, it involves a collaborative effort between different positions and physicians within the hospital. The radiologists who are finding suspicious things on imaging, the surgeons who are investigating operatively, the pathologists who are reviewing the pathology or the tissue samples to rule out the signs of cancer, and then the oncologists who help to coordinate that. And so that is that collaborative effort that's so important, so vital, but what's most important is support to the patient during that diagnosis so that they can go through that with the most strength possible.
So, and Dr. Sutton, how might preventative chemotherapy help in this case? Are there different options depending on the type of cancer?
Well, preventative chemotherapy means something different for each patient. Sometimes clinically you might hear the word adjuvant, for example, and they kind of mean similar things. The main purpose of preventative chemotherapy or adjuvant chemotherapy is to prevent the cancer from coming back in the future. And also, if you're removing a cancer, there are sometimes residual cells or cancer cells that you might not be able to see. And so the point of chemotherapy is to increase your odds of having a successful removal of that cancer as much as you can.
The princess is young. She's 42 years old. And anecdotally, there seem to be more stories of young people getting cancer. What do we need to know?
It's not just anecdotal. You know, we're seeing rising rates. If you look, for example, at the UK for women ages 40 to 44, the most recent statistics were from the year 2021. That was a 7% increase that we saw from the years prior. And also here in the United States, we're seeing rising rates, for example, of colon cancer in people under the age of 50. Colon cancer being now the #1 cause of death for men and the #2 cause of death for women, second to breast cancer. So it's a stark reminder to all of us to make sure that we pay attention to our symptoms and talk to our physicians about our risk factors so that we can get that appropriate screening.
A quick follow-up on that. Now, is this because more people are actually getting cancer or because we're getting better at diagnosing it?
That's a great question, Whit. That's what everyone, in terms of science, are trying to understand. Could it be our environment or something that we're exposed to, more awareness, or just simply more access? We still don't know the answer to that.
All right, Dr. Darien, thank you so much. We always appreciate it.
Of course.
So great to have you providing that context.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.